This is Monica Elmball. I'm inviting you to tune in to my brand new show called The Real Talk of Monica Radio Show. Tune in on August the 23rd from 7 to 8 p.m. every Tuesday for great topics, great guests, segments, and will feature a blend of established and emerging local artists. So tune in again on August the 23rd for a great show, and that's called Real Talk of Monica. And that's Real Talk. Hashtag RTWM Radio.
The First Amendment of the U.S. Constitution, which grants us the right to discuss openly and freely all matters of public concern and to express viewpoints no matter how controversial or unaccepted they may be. Therefore, we are giving the warning that all views and comments on this show are the views and comments of the show's host and callers and not necessarily the views of this radio station.
WCLM 1450 AM, Highland Springs, Richmond.
But welcome back, guys. We're going to have another great segment. And guess what? Can I still have a baby? And we got our guest of honor, Dr. Victoria Davis. Guys, Dr. Victoria Davis, she's here in Richmond, Virginia at the West End OBGY Clinic. And she does fantastic work, and she's also my doctor. So I went to her and I said, Dr. Davis, can you be a guest on my show? She said, yeah, Monica, I think about being a guest on your show. So I'm going to bring her on for the first time. So, guys, be gentle with her. She's a newbie for the first time. So, Dr. Davis, welcome to Real Talk.
Thank you, Monica. I'm happy to be here.
So can you tell our Real Talk viewers a little bit about yourself?
Well, I live in Richmond, Virginia. I've been here for quite a while. I went to medical school here at VCU, and I stayed here for my residency and my more training. And now I have been working actually for 16 years over at West End OBGYN, which is located in the Henrico Doctors Forest area.
Right. So why did you decide to become an OBGYN doctor?
You know, when you're going through medical school, there's lots of things you can do. I sort of like all the different things I get to do as an OBGYN. I get to be in the office. I get to deliver babies. I form nice relationships with my patients. I get to operate. So I consider myself very lucky. I really enjoy my field of work. I like being able to deliver the babies and then hand them over.
and so when I was doing a little research about you, when I went on your on the website, and I was wondering, what is Da Vinci laparoscopic robotic surgery? Can you tell our viewers in case they want to know, especially our females?
Yeah, sure.
Mm-hmm.
You know, over the years, surgery has gotten better and better for people. We can do things what we call less invasively. And for instance, I did a hysterectomy on a patient today, and she probably will spend the night, leave the hospital in the morning, spend about 2 weeks kind of resting, and she'll be up and at 'em. So Da Vinci specifically is a robot, actually. It's very cool. And the arms of the robot simulate what my fingers do on a console. So I can be operating on George over here. I could be in that room.
Wow.
On my little console. I could have attached him to the robot, and I can be over there and operate.
Right.
So it's really, the preciseness of it is excellent, and it just is so accurate, and so they call it high precision, that it allows us to do very technically difficult work through tiny little incisions this big, so we can get rid of the big problems with hopefully a lot of ease for the patients. Better than a big old incision that we used to have to do, just say even 10, 15 years ago.
So in reviewing, Dr. Davis, you primarily specialize in high-risk optometry, and you do teen gynecology. You have interest in pediatrics. So what field gives you your most comfort level?
Oh, that's so hard. I mean,
Yeah.
nothing tops delivering a baby.
Yeah.
I mean, I will
Yeah.
tell you, nothing tops seeing the faces of the family, the grandma. Often the dad looks like he's gonna poop his pants there. He looks like, oh my gosh, what have we done here? But nothing really beats handing over something so precious to a family. So that really is a great thing, and I really, again, you form this bond for 9 months with somebody, and I'll be in the store at Kroger, and
Yeah.
people run up to me and say, "Oh, you delivered my baby," and
Yeah.
you know, I'll get to meet the little kids. It's really cool. I enjoy everything I do, but I think that's got to be the tops.
And one question I had got from one of my viewers is that they wanted to know, can you still have a baby with endometriosis? Is that I'm
Yep.
saying it correct?
Endometriosis. I
Okay.
saw that question.
Okay.
You know, absolutely. Endometriosis is a disease where the inside cells of a uterus, sort of like the seeds of an apple or something, somehow get outside that apple. They somehow get outside of the lady's uterus. And it implants, it can cause pain, it can cause uncomfortable periods, it can cause a lot of scar tissue. It all depends on how severe that endometriosis is and whether it forms scarring around the organs. If an organ gets very scarred up, especially we're worried about the fallopian tubes, then sometimes it can make getting pregnant pretty difficult. But generally, women who have endometriosis, who do successfully become pregnant, they actually feel better
Right.
because their endometriosis goes into remission because of all the hormonal changes in pregnancy.
Oh, wow.
So it's you know, it's never no guarantee, but you know, absolutely people can get pregnant.
Okay, another question was, what are some of the high-risk factors in women starting a family in their early 40s?
Okay, well, I saw that too, and what I'm going to do is dial it back a little bit, because
Okay.
when we as doctors tell people things, we don't make this up out of the blue. It's not because even of what we've sort of seen through the years. These are evidence-based studies that have been done, and somehow they have picked the age of 35 to consider someone what we call high risk. Really sadly, they call them elderly gravidas, which is an awful word. I always feel bad, but that's sort of the technical term for it. And it just means you're having a baby a little beyond your prime. Now, having a baby after 35, you can have a perfectly normal pregnancy, a perfectly normal baby. It doesn't mean you're doomed. I get a lot of people really worried around age 34 saying, oh my gosh, if I don't get pregnant in 2 months, everything's going to go, I'm not going to ever be able to get pregnant. That is not at all true. It's more of a continuum.
Right.
But I would say around 35 and over, compared to 35 and under, the risks of everything go up. The risk that you might have trouble getting pregnant, the risk of, once you are pregnant, having a miscarriage, the risk of chromosomal problems like Down syndrome. Actually, all birth defects rise after the age of 35. This is all statistics. Needing to have a C-section for any random reason increases over the age of 35. Developing high blood pressure, developing diabetes, ending up with a complication that might make us have to deliver your baby early. All that stuff, and then you actually taking home a preemie baby instead of a term baby, all that increases as you get older and older and older. So those are your risks sort of once you're pregnant. Then, of course, the issue is how am I going to get pregnant? Am I going to get pregnant? And that's a tough one.
Okay. All right. At 7:50. Okay. The next thing is, what would be a good age to advise females to about freezing their eggs?
You know, I recently spoke with one of our fertility specialists about this, and he was explaining to me some statistics, which even surprised me a little bit. He said that after the age of 38, so you got that birthday tomorrow, Monica. After the age of 38, just again, statistically, doesn't mean you in general, but statistically, the quality of your eggs decrease. So the sooner you can do it, the better. He said that the most frequent reason he freezes ladies' eggs is because they're in between relationships. Maybe they got married at 29 and they thought they were going to start a family. Didn't quite happen. They end up getting a divorce. They don't really have a Mr. Right now. They're thinking they might get married eventually, but they're getting nervous. So actually, the younger you freeze your eggs, the better. And he said that's probably the most typical situation. And he really discouraged one thing that I think we all think about when you think of freezing your eggs, saying, oh, well, you know what? I've got a career to worry
Yeah.
about. I've got my something else going on in my life. I got a sick family member I'm taking care of. And he really said, don't ever think that you're going to have that guarantee, because there are ladies who try to freeze those eggs. Remember, they can freeze them, but then they've got to hatch them.
Yeah.
And they've got to retrieve them.
Yeah.
And sometimes those eggs don't make it. And again, the younger you are when you freeze those eggs, the more likely they will be viable later.
So what age would you recommend?
Probably 30s, like early,
Oh, wow.
like 30 to 33 or something like that.
Wow.
You're going to get better results. Now, that doesn't mean, so that's for ladies who are thinking for the future. So,
Look at the guys like, I want to hear this thing.
no, it's good. It's still
Yeah.
good.
Yeah.
You're in a different boat. You're not 30 thinking of purposefully delaying getting pregnant. You're totally different. So for you, you have a statistical game to play,
Yeah.
and you just got to wing it. And I do tell people, again, for you, if you said, well, I want to go on a trip to the Bahamas, and then I want to do this, and then I want to do that, I'd say, you know what? Forget that silly trip to the Bahamas. Just go for it. Don't wait. I think that's a problem people will do.
I think, is it expensive too, Dr. Davis? Is it you got to somewhat kind of plan this,
You absolutely have to plan it. Young couples, people who aren't sure what's going on with their lives. I mean, all this does cost money. It's expensive. And, people say, where the heck am I going to get, the thousands of dollars? If you think about it early enough and you have that little coffee pot that you put everything in, you can, over the years, you can whittle away into it.
Yeah.
You can. You think you can. It's such a big number sometimes that you think it's not going to work. The other thing I do always tell my patients is if you're having trouble, and, I work with people a little bit initially with infertility, but then I always tell them if I can't get them pregnant in about 3 or 4 months, I'd like to send them away to the fertility guys. And I think everyone's very hesitant to do that because the fertility doctors, they think, oh, money, it's going to cost this, it's going to cost that. I mean, there are many steps before you get to in vitro fertilization. That does cost $6,000. There are many steps that are much more reasonable, a couple $100 to think about doing initially. So you never know. You always go in stepwise fashion. You never jump to the end. You always take it a step at a time.
Sarita, you got a question for Dr. Davis?
Sarita doesn't have any problem with the pregnancy.
Yeah, you have, 3 kids, right, Sarita?
I do. I have 3 children, and then I can relate to Dr. Davis because I am a surgical tech, and I work in labor and delivery in Memorial Regional.
Yeah.
So everything that she's talking about, I'm like, yes, I agree, But I just want to agree with what she said about, I love, you can do any type or assist in any type of surgery, and I have done different surgeries, but I love that my specialty is working in labor and delivery because the fact that it's just a beautiful thing when new life entered this world.
Okay.
And I love working with babies.
Well, Sarita, I'm sorry. Let's formally introduce yourself to our audience. Go ahead.
Hello, everyone. My name is Sharita Prentice. I am working on to become a fitness model, and I also work as a surgical technician in labor and delivery.
Wow. And you have 3 kids?
Yes, I have 3 beautiful children. My daughter is 9. My sons are 2 and 1. Irish twins.
And so why do you love doing what you're doing? You said basically similar to what Dr. Davis said.
Oh, yes. Yeah. I just to see, just to see new life into this world is a beautiful thing. Just to see a smile on everyone's face, the family members. It's just beautiful just to know that, you helped assist in this delivery. You helped get their baby out, and it's just beautiful. I just love I love putting a smile on other people's faces, and I just love working as a surgical tech.
Yeah, I always tell people, this is your delivery. It's not my delivery. It's your delivery.
Yeah.
And people, they remember things about their delivery. I mean, again, any of you who have children, I bet you can think back and say, oh, yeah, I remember being in labor and what I was wearing or what you were doing and whatnot. And it's a real honor to
Well, that's
be
why
a
I was
part
getting
of
ready to
that.
ask you, Dr. Davis. Have you had like one of those success stories where, like, a young lady and like a couple, they was trying and then they found it, without any names and going into detail, that they had a long journey and then you helped them get to the promised land of helping them through their pregnancy.
I have, and I've had a few, and the one that's a little off base of sort of what we're talking about, but similar, is a couple that, gosh, they really wanted a child. They tried. They were always successful getting pregnant. The pregnancies just wouldn't stay.
Yeah.
And they would lose the pregnancy, sometimes early, sometimes pretty late, like, 4 or 5 months along. And that's just awful because by that time, everybody knows you're pregnant.
Yeah.
People are asking you stuff.
Yeah.
It's just awkward and really hard. And they tried alternative medicine and they tried all different things. And, I worked with several other physicians and trying just anything. We tried anything for this lady to try to get her something successful going. And you know what she did in the end? She adopted twin girls from her home country. She's not from here. And they are the most beautiful girls, and she is so happy. And, I will say over and over again, a family is not semen and an egg. A family is, who loves you at home and what you make of it, and no one would think otherwise. I mean, their love for these two little sweet girls is so wonderful, and, she's so happy, and it's so funny. She's so appreciative of me. Well, I don't feel like I did anything. I felt bad. Everything I did didn't work, So, but she, I'm just so happy for her. And she is just beside herself now, as evidenced by her 5 million Facebook posts per day of these two little sweet girls. So, yeah.
Wow, cool. So, another thing I wanted to know, what a lot of people wanted to know, Dr. Davis, is do you recommend genetic testing for women who are trying to become pregnant at a later age? And I say that because, especially for African Americans, about the diabetes situation that can be, you never know that they might not have it, and then when they become pregnant, then some kind of way they develop it.
Right. Diabetes is something that we see in pregnancy. Sometimes you have it, and then it goes away after pregnancy. Sometimes you have it, and then you're sort of always at risk for it, and you'll get it again one day. It's always a good idea to make sure all of your health is in order,
right?
Especially when you're a little older. And that's actually the first thing I ask people who do come in for a consult when they're, say, 42 years old. What are your other health issues?
Right.
And that's half the problem of old ladies getting pregnant. And I'm using that term being silly here, but it's that by the time you get to be 40-something, you've developed all these other problems.
Yeah.
When you're 22, you don't have diabetes. You don't have high blood pressure. You don't have these problems as often as you will when you're 40 and 50 and on and on. So it's a sort of, again, a linear thing. So the first thing we do is we look at their health, and we look at optimizing their medicines, because sometimes people are on a blood pressure medicine, say, that's not so good to get pregnant on. We better, if we know you're going to be pregnant, let's switch it to something that everyone can, know it's not going to harm the baby, and then we'll optimize all that. If you're a diabetic or you think you might be pre-diabetic, let's watch those sugars real closely, because actually when you get pregnant and your sugar's out of whack, you have a higher risk of miscarriage than if you were the same person with normal, well-controlled sugars. So we always want you to have all your health care optimized, always. And speaking of that, sometimes it's easier for us, and you'll have a better outcome to take care of a 42-year-old healthy person than a 32-year-old with diabetes and blood pressure and all those other issues going on. So it's more health than age, but as we get older, our risk of the health issues is more. With the genetics piece, which is a little bit different, we worry about chromosomal problems as we get older. eggs get old and sticky is what actually happens. And when the eggs are sticky and they go to separate into the sperm and the egg and everything, they can carry extra parts of genetic material. And that's where you end up with things like trisomies, which are trisomy 21 is Down syndrome, and there's trisomy 18 and 13, which can be lethal, essentially. And in order to figure out if you have a fetus that has one of those problems, it actually is amazing now. This has changed so much even since I started practicing about 20 years ago. We can now draw your blood at about 10 weeks and tell you with pretty good certainty we think the baby's fine.
Wow, at 10 weeks.
10 weeks.
Wow.
This is very new. Some insurance covered it, some insurances
Yeah.
don't. The whole thing, we're going through all that right now. But it can be available to anybody. So, that's comforting mostly. And then, if a couple had a situation where they just knew bringing a child into the world like that could not possibly be an option for them, at least they have time to think about that and options and whatnot. It's not definitive, but it's pretty darn good, reliable test. So, and that's really revolutionized the way we see people. I shouldn't say this, but we can actually tell you the sex of the baby, too.
Look, Dr. Davis, somebody knew you was coming on, one of your patients. They said, please bring Dr. Davis on for the month of breast cancer. I said, I have to find out first. I can't just be pulling her in.
That's October. That's coming up.
I know. They want you to come back. Yeah. And I think I shared you one of the posts, one of my Facebook friends. She's a patient of you, and they were so excited. They couldn't wait for you to come on.
That's nice to hear.
Yeah. And I said, well, we have to check your schedule because I know you'll be very busy. So we'll see.
I need some more likes. My children were not very impressed with the amount of likes I had up there. It's all about the likes with those little kids.
Yeah, you got to have a whole lot of likes. You hear that, guys? You got to make sure we do a whole bunch of likes for Dr. Davis. And how old are your kids, Dr. Davis?
Oh, my kids are 11.
Okay.
Just turned 10.
Okay.
And 8.
Wow. So they all on social media. Yeah. And then you got a doggy, right?
Oh yeah, I have two sweet doggies. One big boy Baxter. He's a big old 100-pound goofball. And his sidekick Maggie.
And they didn't get mad that they said Mom took a break to come on the show.
Oh, it's all mayhem at my house right now. My husband thinks he's got it under control. He doesn't know what he's doing. He's okay.
Yeah, he could wait.
He's called me like 8 times. He's okay. He's a good guy. But
well, guys, if you got any more questions for Dr. Davis, please call us at 804-231-7685. Again, at 804-231-7685. Guys, please tune in to the Real Talk with Monica radio show on WCRM 1450 AM, the heart and soul of Richmond, RVA. And what's the time now, Walter? Okay, 7:48. Come on, guys. Got a couple more minutes before Dr. Davis go on. She got to take care of those kids. Before we leave out, Dr. Davis, we can find your practice at 7601 Forest Avenue, Suite 100, Richmond, Virginia, 23229. And also at westend-obgyn.com. So you have any final words, Dr. Davis?
Just thank you for having me on your show, and make sure you do go get your care. I push everyone, especially the young girls. They come see me every year because they need those birth control pills or whatever it is their excuse to come see me. But because I hold them hostage if they don't come in. But I also encourage everyone. Most insurances will cover you to see me once a year. They cover you to see your primary care once a year. People don't realize that, and people think, oh, I'm so young, I don't need to go see my primary care doctor. But you know what? Take advantage of your insurance. Go have an annual exam. They do your blood work. They check your thyroid. They check that for diabetes. They check your blood pressure and all that good stuff. Because I take care of part of you, but there's a lot of other part of you too. So make sure you're taking care of yourself.
Yes, guys. Dr. Davis. Oh wow. Okay, let's see what we got right there. Let's see what we got on the phone. Okay, that's 7. Okay. Yes, caller. Yes, caller. Okay, he'll call back. Okay, all right. Yes, well, we're going to go ahead and Rosie, let's go ahead and take a break, and then we'll wait for the next caller to call up. Okay, and guys, continue to support Real Talk with Monica, and thank you again, Dr. Davis, for coming on. And you know what? That's real talk.